This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello, and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, a senior attending here, and I'm joined as always by our research fellow.
And I'm Dr. Alara. Today we're looking at a fascinating new study from the Journal of Neurosurgical Sciences, published in 2026. It's a systematic review and meta-analysis titled Rapid versus Gradual Weaning of External Ventricular Drains in Aneurysmal Subarachnoid Hemorrhage.
This is a topic that is bread and butter for anyone covering the neuro ICU. We know that aneurysmal subarachnoid hemorrhage, or ASAC, commonly requires the insertion of an external ventricular drain, or EVD, to manage acute hydrocephalus and monitor intracranial pressure. But once the patient stabilizes, the million-dollar question always arises: how do we get the drain out?
Exactly, Dr. Aris. If you ask 5 different attendings, you might get 5 different weaning protocols. Some prefer a gradual approach, lowering the bag or intermittent clamping over several days, while others advocate for a rapid wean. This study finally aims to compare these rapid and gradual weaning strategies, using measurable outcomes to see if one is truly superior.
It's about time we had a robust meta-analysis on this. In clinical practice, the gradual camp usually argues that it allows the arachnoid granulations to slowly pick up the slack of CSF absorption. The rapid camp, however, argues that the longer that drain stays in, the higher the risks. What were the specific outcomes this paper looked at, Alara?
The authors focused on 3 primary measurable outcomes: infection rates, the total length of hospital stay, and the requirement for a permanent ventricular peritoneal shunt, or VPS. These are the metrics that really drive our clinical decision-making and hospital resource management.
Let's dive into the big one first, the VPS requirement. That is the ultimate fear for a resident or an attending during a wean. If we pull the drain too fast, are we causing a failure that leads to a permanent shunt? What did the meta-analysis find?
Interestingly, the study found that the requirement for a VPS was not significantly affected by the speed of the weaning process. Whether the patient underwent a rapid wean or a gradual weaning strategy, the rates of permanent shunt dependency remained comparable. This suggests that the training of the brain to absorb CSF through a gradual wean might not be as necessary as we once thought.
That's a significant finding. It challenges the traditional dogma that a slow wean tests the patient's physiology more safely. If the outcome, needing a permanent shunt, is the same, then we have to look at the secondary risks of leaving that EVD in longer than necessary, which brings us to the next point: infections.
Right. We know that EVD-related ventriculitis is a major complication that can extend recovery and worsen outcomes. This meta-analysis looked closely at infection rates. While the paper notes that the effect of rapid versus gradual weaning on infection rates has been debated, the synthesized data suggests that rapid weaning does not increase the risk of infection. In fact, by reducing the total number of train days, you're theoretically narrowing the window for potential colonization.
And that ties directly into the third outcome, the length of stay. In a busy neurosurgical service, ICU bids are at a premium.
Precisely. The study found that rapid weaning strategies were associated with a decrease in both ICU and total hospital stay. Because the weaning process is truncated, patients are moving out of the intensive care setting faster. When you aggregate the data, the efficiency of the rapid wean becomes quite clear without a compensatory increase in complications.
So to summarize the findings for our listeners, compared to a gradual approach, rapid weaning of an EVD in ASAC patients does not increase the rate of ventriculoperitoneal shunt placement, it doesn't lead to higher infection rates, and it actually shortens the hospital stay.
That's the core of it. The authors highlight that the effect of rapid versus gradual weaning on infection rates, hospital stay, and requirement for VPS is not known was the starting point of their inquiry, and their results provide a much clearer roadmap for us.
For the residents listening, this is important. It means we should be looking at our patients daily and asking if they are ready for a rapid challenge, rather than reflexively ordering a 5-day step-down protocol. It's about evidence-based efficiency.
It also suggests that the gradual approach might be adding unnecessary days to a patient's hospitalization without providing the protective benefit we previously assumed.
A very impactful study for our daily rounds. Ilara, thank you for breaking down the data from the Journal of Neurosurgical Sciences.
My pleasure. It's a great reminder to keep questioning our standard protocols.
That's all for today's episode of the Neurosurgery Hub podcast. Join us next time as we continue to bridge the gap between the latest research and the operating room. I'm Dr. Aris.
And I'm Dr. Alara. See you next time.